Tibial tuberosity is a distinct bony landmark located on the proximal tibia, and to palpate this, it is just inferior to the patella, so you find the patella and then move directly down until you find the distinct bony landmark located about right there. The medial tibial plateau it's the proximal tibia, and you can palpate this within the soft tissue depression alongside the patella, and you can actually feel the little ridge on the proximal tibia, and then you can actually follow that little ridge medial of the patella. The medial femoral condyle is medial to the patella, and so if you find the patella and move medially, and it'll be the first bony landmark that you can feel on the femur. The adductor tubercle is the posterior medial portion of the medial epicondyle of the femur. It's easiest to palpate when the patient is in 90-90, like what we have here. So to palpate this, you find the condyle and the epicondyle, and then you can actually feel where all of the adductor muscles insert. It would be this area right in here. The medial and lateral joint lines are located in the soft tissue depression just right alongside the patella. So you have the medial joint line and the lateral joint line right in there. So here's the medial and here's the lateral joint line. The patella is also known as the sesamoid bone. So the patella we have in blue here. It's also known as the kneecap. And then within the patella, there's the superior and inferior poles. So on top is the superior pole, and below is the inferior pole. And then we also have the medial and lateral borders. So here we have the medial border in orange, and then the lateral border. The lateral tibial plateau is palpated just like the medial tibial plateau, but on the lateral side of the knee. So to palpate the lateral tibial plateau, you find the soft tissue depression on the lateral side, and you'll find it along the bony ridge of the tibia. You just follow that ridge laterally, lateral of the patella. The lateral femoral condyle is most easily palpated when the knee is flexed to greater than 90 degrees, like what we have here. And it will be the bony landmark, so you find the tibia and you move superiorly. So there we have the lateral femoral condyle. And then moving lateral to the condyle, you have the epicondyle, which will be the next bony landmark that is palpable. The head of the fibula is palpated just lateral to the tibia and inferior to the joint line. So you find the tibia, you move laterally, and then you find the head of the fibula, which does not articulate with the femur. The trochanter groove is also known as the femoral sulcus. It's the track that the patella glides in. To palpate the trochanter groove, you place the thumbs in your patient's joint lines, and then you follow superior to the highest points of the patella, and then you can actually push down, push up, and you can actually watch the patella glide. And this is the trochanter groove. The quadriceps is a group of 4 muscles. In the orange we have the vastus lateralis, the green is the vastus intermedialis, and the blue is the vastus medialis. The pink is the rectus femoris, which is the only quadricep muscle that actually crosses the entire knee joint, crossing the patella right here. All 3 of the vastus muscles are deep to the rectus femoris quadricep muscle. The infrapatellar tendon is found at the inferior border of the patella all the way to the tibial tuberosity. So to palpate the infrapatellar tendon, you find the inferior border of the patella, which is right here, and then you can actually feel it if you do a little cross friction all the way down to the tibial tuberosity. So it's a little tendon right in there. There are 3 superficial bursa of the knee. In the orange, we have the infrapatellar bursa, which is palpated deep to the skin but superficial to the tibial tuberosity. So we have that in the orange there. And then in the green, we have the prepatellar bursa, and that's palpated between the patella and the skin. And then in the blue here, we have the suprapatellar bursa, which is palpated at the distal femur between the superior patella. So it would be this little area right in here. The pes anserine is the insertion of the SGT, the semitendinosus, gracilis, and sartorius. It's palpated on the medial proximal tib, and most patients will tell you that it is the tender spot. So to palpate this, you find the tib, and then you move proximal, and then medial, and then you can actually sometimes feel that it's the insertion of many of those SGT muscles, and then watching your patient's facial expression, you can depict that this is the pes anserine right here. The meniscus is a cartilage disc palpated medial to the patella. It's best palpated when your patient is in standing with some tibial internal rotation. To palpate this, you find the soft tissue depression. Then you can actually palpate the cartilage disc medial to the patella. The medial collateral ligament, also known as the MCL, is palpated from the medial femoral epicondyle to the tibia. So to palpate the MCL, you find the femoral epicondyle, and then it comes all the way down to the top of the tib. So it's just a very small ligament right in there. The SGT muscles all insert at the pes anserine. As you can see, what we have in the orange is the pes anserine. The S in SGT stands for sartorius, and that's the muscle that we have in blue here. So it inserts at the pes anserine, but then actually originates, so it'll come up and then originates at the ASIS. And then in the pink here, which is the G, stands for gracilis, and that inserts at the pes anserine as well, but then actually originates, so it comes up the thigh and then originates at the pubis. And then in green, inserts again at the pes anserine, and is the T, standing for semitendinosus, and that is actually one of the first hamstring muscles, so it inserts at the pes anserine and then originates at the ischial tuberosity, so it comes all the way up. The lateral meniscus is a cartilage disc palpated lateral to the patella. It's best palpated when you have the patient in slight flexion, just as we have here. The lateral meniscus is just superior to the tibial plateau. So you find the tibia, then you find that tibial plateau right in there, just that little ridge. Then you can actually feel the meniscus, that cartilage disc right in there, just lateral to the patella and superior tib. The lateral collateral ligament is also known as the LCL. It's best palpated with the patient's legs crossed, like what we have here. And to palpate the LCL, you find the lateral femoral epicondyle, and you follow the LCL to the head of the fibula. So you palpate the lateral femoral epicondyle, which is right here. And then you can actually feel it if you do a little bit of cross friction all the way to the head of the fibula. So you'll be able to palpate it right along there. Anterior superior tibiofibular ligament is a small ligament that attaches the tibia to the fibular head. So to palpate this, you follow the tibia to the fibular head, and it's just this small ligament right in here. So you find the fibular head to the tib. And again, you can feel the ligament by doing a little bit of cross friction. The biceps femoris tendon is best palpated when the knee is flexed. It's a tendon that comes from the posterior knee and inserts to the fibular head. So to palpate this, you start in the posterior knee, and then you can actually palpate the tendon back there. Then you can follow it to the head of the fibula, which is right there. The iliotibial tract is also known as the IT band, and it's best palpated when the knee is in extension, just like this here. It inserts at the tibial tuberosity, and then you can palpate it moving superiorly. It's most palpated right in here. It's not muscle, it's actually just a thick band of fascia. You can palpate that right in here. Peroneal nerve is palpatable where it crosses the neck of the fibula. So to palpate the common peroneal nerve, what you have to do is find the head of the fibula and then move to the neck of the fibula. So the common peroneal nerve is palpatable right in there. Here in the blue, we have the popliteal fossa, which is simply the posterior aspect of the knee. And then in the pink here, we have the gastrocnemius muscle, which is also known as the gastroc. And that originates at the condyles of the tibia. So we have the medial condyle and the lateral condyle. And then that inserts all the way down the calf until you reach the calcaneus. So a little bit lower of what I have here. Within the popliteal fossa, the blue paint that we have here, lies the posterior tibial nerve, which is actually the most superficial. So it runs right along in the popliteal fossa and then all the way down. Then deep to the posterior tibial nerve lies the popliteal vein, and then deep to that, which is actually non-palpable, is the popliteal artery, which is the most deep.